Hi everybody, this is Paul from Eval Pal. Today I want to talk a little bit about cubital tunnel syndrome and nerve gliding and nerve entrapment and how it can look like other things. So I have Doug here. Doug is 44 years old and last year had surgery because he had a significant left upper extremity radiculopathy. He's kind of worried that that's going on this side now because he's having significant tingling, discoordination of his hand, especially when playing the guitar or fiddle. And so what I did was try to sort out, is this a new cervical spine problem or does he have something else going on here? So we did everything from reflexes, C7, C6, C5, and those are equal on both sides. He has equal sensation on both sides. He has equal cervical spine rotation with no radiculopathy. He does have pain around the scapula, and you need to remember this, that if somebody has scapular pain, it's usually more apt to be nerve-related than anything else. And this I've seen through experience. I used to treat myofascial issues of the scapular region with very little success until I started tractioning patients to find that the cervical spine is a bigger contributor to scapular pain than anything else. So we checked the cervical spine. We did a cervical spine compression test. We did a Sperling's test. All those were negative. So the more important thing here is that we tested his muscle strength. Okay, and he is good. Okay, so let's go ahead and spread those fingers out. And his intrinsics are just a little bit weaker on this side than they are on this side. Everything else, wrist extension, elbow flexion, extension, supination, pronation, all those are within normal limits. His rotator cuff's within normal limits. So then the next thing we did was check out a Tunnel's to find that that does reproduce some tingling. He does have some discomfort at night when sleeping, all right? Mm-hmm. And if the arm is flexed for a long time, this gets a little wonky.
Oh yeah.
And other positional things like standing like this and looking up increases the ulnar nerve distribution discomfort. Okay? So one of the things that we did find is that when he does strain the ulnar nerve and put some stretch through it a little bit, he seems to have some increased scapular discomfort. When he puts his arm in a certain position, the scapula flares up pretty quickly. When I palpate a scapula, I get no discomfort back there. He has no signs of a long thoracic. I had him do like a serratus punch, and he has no instability there. He has excellent periscapular strength. So I'm not suspicious that his scapular pain is coming from his neck, and I'm not suspicious that his ulnar distribution pain is coming from his neck either. I think he has cubital tunnel syndrome, and I think he has some brachial plexus nerve immobility. So we're going to be setting him up with some nerve gliding exercises such as this one here, where you keep the arm, the forearm in flexion, go into extension, open up the fingers, and then flex the elbow. And then do some nerve gliding activities like that and see how he does. So he's going to nerve glide every day, 3 times a day, nice and gently. Okay, you should never push through nerve glides because that can aggravate the nerve and it can get really irritated. Okay, so it's going to be light and easy, correct? Because this guy likes to do everything at 110% and likes to push it. So we're going to go easy for about 2 weeks, 3 times a day, and we're going to reassess and see how he's doing to see if the scapular discomfort settles down and if the ulnar distribution pain and paresthesia settle down. If they do, then great, he'll continue with nerve mobility type activities. But in the meantime, he is lined up for a cubital tunnel release and in about a month from now, so I'll see how he does with the nerve gliding, and we'll go from there. So if you have any questions, get in touch with me at orthoevalpal.com. Just go to our Get in Touch page. You can throw some questions on there. I check those just about every day, and I'll get back to you. So thanks for listening. Appreciate it. Bye.